Hello, this is Stephanie, and I am doing my reflective and action video journal for the capstone class. And I am asked to, for this particular assignment, to answer the following questions that are listed. So I was to review the learning objectives for the course and answer these questions, which I have went over the syllabus. So now I'll just answer the questions. So the first question states, how do you feel that the course objectives relate to your current and future role as an evidence practice nurse? It does not say base. Evidence practice nurse. So this course with the capstone, you have to do a lot of research and be able to implement the evidence-based practices in doing so. So I think that this course helps us to be able to understand research and what it does, and also be able to understand the importance and to drill to us that evidence-based practice is needed in our everyday practice. It allows for some of us who are interested in knowing how to research, what to research, how to make it worthwhile researching and making it understandably important to the field of nursing. So I think that this course is very respected in the means of just the research and the evidence-based practice portion, not only just not trying to eliminate just knowing how to write a paper and all of that, but mostly the evidence-based practice and the research is very important in this class. So the next question asks to review the assignment descriptions that are posted in each week of the course. What questions or concerns do I have? So at the beginning of this program, the capstone was presented to us, and each class term, we were obligated to do a piece of the capstone. If I am not mistaken, the last time we've done it was in the beginning of this year, and I think we had to do the literature review part. So since then, we have not done anything with the capstone. And the reason why I bring this up is because this question asks my concerns. My concern is that I don't think that I will struggle, but I think I will kind of have a lot of emails sent out to Mr. McCraney weekly in regards to making sure that I'm doing the assignments right and appropriately for the course description. As long as the instructions are, straightforward, I shouldn't have a problem. But being that this is the first time since the beginning of the year that capstone has been implemented within our class studies, I think that a lot of us will have questions in regards to what is expected of us for these upcoming assignments that are regarding the capstone. So the next question asks, overall, what are you looking to get out of this course? So this course, I basically hope to just gain more competency in the transition. I hope to feel more comfortable in transitioning to an advanced practice nurse. Each term I've gained more confidence. I feel more and more comfortable. So hopefully that will continue. I know I've been told, many times through practitioners and doctors, it takes, anywhere between a year or two to really, really feel comfortable and, to say, I'm an NP, I can do this. I guess to each his own. I have never been the type of person that just take things and run. I know it. And neither have I been a coat teller where I feel like somebody, I have to just, feel less competent to do things on my own. I am a technical learner. And once I see the way things are done, understand why they're done, and then I can present as follow. I'm also a why person. If I don't feel that something is shouldn't be, I'll read it and make sure I'll ask questions. Again, I'm a why girl. So I feel and I trust myself to know that I won't just run away so fast and say, I got it, because it's not meant for that. So with this course, I'm hoping also to be able to just continue with the evidence-based practice, as I know that is needed in the field, to be able to utilize that in the everyday practice field. So I think this course is necessary in that aspect, to be able to continue with evidence-based practice. It was presented in the beginning. It's presented in nursing as well, but from the beginning all the way to the end, and that's appreciative. And knowing that you can always, no matter what, it's your Bible, to utilize it in the practice field. So the next question asks, what experiences and expertise to you have that you feel, I don't know why they say that, will help contribute to the learning community in this course? So I think what that question is trying to say is what experience and expertise will help you contribute to the learning community in the course. So I think that the experiences and expertise that I can utilize to help contribute as a learning tool to the community in the course, I think that basically just utilizing evidence-based practice, just continuing to use research, continuing to keep up with the different things that come out in the practice, such as with the medications and the ways that you treat patients, the conferences that are utilized for nurse practitioners, to keep you up to date with the things that are utilized, just keeping yourself, in the now and not getting too backtracked with the old you, just staying up to date with things, just working together. I know it's a great thing to work along as a practitioner. As of right now, I don't have a interest in having my own practice, but who knows, later maybe. But I think doctors and NPs can make music when they can get along and agree to the way that they practice. I know that it can be a great opportunity to be behind that of a doctor that's not egotistical and willing to listen to you and also teach you some things, even other NPs that's just been in the field a long time that just have that experience. I know plenty of our teachers throughout this term I listen and I have learned from. It's a great thing to have somebody Southern, as such as Mr. McCraney from Alabama. I am from Atlanta. And it's not like crazy different in the medical profession, but I have seen some things that differ in the way that the practice are utilized here in California. So just from our last experience together when we had the clinical portion of the acute illness class, going back off of those things where we would just talk about our patients and what normally is done. The past teachers we've learned from and been able to utilize those things. And I know if the teachers say, oh, normally we do this, and I'll always go back and, say, so, hey, normally, or did you all used to do this? And, no problem. They'll explain it. So it's a good tool. So in this class, I'm just hoping to gain as much as I can, to be more competent, to feel more ready, to just be able to contribute to the field and not just go in the field. I want to be a great contribution to the field of advanced nursing. I am excited about this term, excited about this new role, and just hopefully this class will give me everything that its expectancies would be, and that I think it would be. And again, I appreciate the teachers, and best of wishes to my classmates. Bye for now.